Namaste. I am Dr. Veenu Agarwal. I am an obstetrician and gynecologist with Cloudnine Hospital, Golf Course Road. Normal delivery can be divided into 4 stages. The 3 stages of labor and the 4th stage or the recovery stage. The first stage of labor is from when you start getting good contractions till the cervix is completely dilated or taken up. This first stage has an early phase wherein the contractions are slowly and gradually building up with gradually increasing intensity of contraction. They are coming more frequently and then gradually their duration also increases. It is better to stay at home during the early phase. You can move about, do some exercises or take rest as you feel during this phase. You can take a bath or distract yourself like listening to music or watching a movie, spending time with your family. You can also eat some light meals during this time. Make sure that you stay hydrated during this time. You can ask your partner to massage your back or support you during the contraction. Once you go into active phase, when the pains are coming more frequently, you should reach the hospital. Once you reach the hospital, the baby's heartbeat will be monitored and you will be admitted to the labor room. During this time, continue to stay active, focus on your breathing and try to breathe right with deep inhalations and exhalations. It is important to stay hydrated even during this period and try to stay calm and relaxed as much as is possible for you. The second stage of labor is from when the cervix is fully dilated till the delivery of the baby. During this time, you will get very intense pains and you may also have the urge to push out the baby. You will be supported by the doctors and the staff in the hospital during this time to assume the best positions to help you deliver the baby. Continue to focus on your breathing, taking deep inhalations and exhalations in between the contraction. You can push gently the baby out and you will be supported by your birth partner and everybody around you. Don't worry, this is the time that your baby is about to come out. So stay focused and stay positive. The third stage is when after the delivery of the baby till the delivery of placenta. You will start feeling some cramping again and the placenta will be delivered by the doctors. After the placenta has been delivered and the baby is handed over to the pediatrician, the 4th stage begins. This is the recovery stage. Your BP, pulse and your bleeding will be checked. If there has been a tear, then it will be stitched. You will be given something to eat and you will be able to breastfeed your baby during this time. After that, you can rest and enjoy your time with the baby.